Hello, everyone. My name is NK from the RN Couple Diaries, and today I'm going to be talking about postpartum hemorrhage. What is postpartum hemorrhage? Postpartum hemorrhage is an excessive vaginal bleeding that occurs after birth, which leads to a significant blood loss. It is characterized by vaginal births, loss of greater than 500 ml of blood, cesarean birth, loss of greater than 1,000 ml of blood, and a decrease in the hematocrit value by 10% when compared to the previous value before birth. Now, what is the pathology? Uterine contraction helps to control bleeding after birth. So when the uterus is not contracting, it means that it is not compressing the blood vessels that is at the placental implantation sites, which impairs blood coagulation and increases the bleeding from that site. Okay. Now, there are two main types of postpartum hemorrhage. We have the primary and the secondary postpartum hemorrhage. The primary postpartum hemorrhage occurs within 24 hours after birth, while the secondary postpartum hemorrhage occurs 12 weeks after birth. Now, what are the causes of postpartum hemorrhage? There are four main causes of postpartum hemorrhage. We have the four T's, which is how I used to remember it. We have the tone. Now, the tone stands for the uterine atony or the bogey uterus. Now, what this means is that the uterus is not contracting. Okay, then for trauma, if there's a traumatic birth that causes a large laceration or uterine rupture, then the patient is at risk of uterine postpartum hemorrhage. Now, for tissue, if there's the retained placental fragments, then it can lead to postpartum hemorrhage. And for thrombin is a coagulation factor. And when that coagulation factor is absent, it prevents blood coagulation, leading to a coagulation disorder that increases blood loss. Now, for the main cause for the primary postpartum hemorrhage are tone and trauma, because this occurs within 24 hours after birth. While the main cause for the secondary one is tissue and infection. So if there's a retained tissue or there's an infection, it can occur within 24 after 24 hours of birth or even within 12 weeks. That's what we call secondary postpartum hemorrhage. So now, what are the risk factors of postpartum hemorrhage? Like I said, I always like to use acronyms. So I remember it with the 3MP. But we need to understand that the primary cause of postpartum hemorrhage is an overdistended uterus. This is because it makes the uterus so boggy, which reduces the rate of contraction or makes it not to contract so well. Okay. Now, what causes overdistended uterus? We have macrosomic fetus. These are large infant size of greater than 8 pounds. Then multiple gestation, say pregnancy with twins, triplets, quadruplets. Then multiparity, a person that's had more than one pregnancy, right? Like 2, 3, 4 pregnancies, because the more you get pregnant, the more your uterus expands and can lead to overdistension. Then we also have the polyhydramnios. Now, polyhydramnios simply means excessive amniotic fluid. Now, when there's excessive amniotic fluid, it makes the uterus big and causes overdistension of the uterus. What are the signs and symptoms of postpartum hemorrhage? The main sign and symptom of postpartum hemorrhage is heavy and uncontrolled bleeding. Now, if a patient tells you that she has changed more than one pad within 1 hour, then that you need to think and say, okay, something is going on here. Okay. Another sign and symptom is deviated uterus. And when the uterus is deviated to the right, it's usually mainly caused by a distended bladder because the bladder is full. So when the bladder is full, it causes the uterus to deviate to the right, which can reduce the contraction of the uterus and lead to increased bleeding. In this scenario, you have to let the patient know that, okay, the patient has to go empty the bladder. But if the patient is unable to empty the bladder, you can drain the urine using a Foley catheter. Okay. Now, one sign and symptom that I always remember is hypotension and tachycardia. This is because for every excessive blood loss, like every patient that comes into the hospital with excessive blood loss, two things you would always notice is hypotension and tachycardia. Okay, this is because the patient is already dehydrated and the body is just trying to compensate for the dehydration. So that is how I always remember hypotension and tachycardia as a sign and symptom of postpartum hemorrhage. Now, what are the nursing intervention? Like, what will you do as a nurse in this scenario? The first thing to do is to massage the fundus. The idea of massaging the fundus is that, like, the fundus will know that, okay, something is happening and it's going to immediately start to contract. Whenever you massage the fundus, it always starts to contract immediately and is going to help to reduce the blood loss. The next intervention is to administer oxygen depending on the SpO2 level of the patient. If the patient's SpO2 is no longer within the normal variables, then you have to administer oxygen to help to prevent the patient from becoming hypoxic. Now, another intervention is to administer IV fluids to help to prevent the dehydration, to help with the dehydration. And if the doctor has prescribed blood products, this is the time to also administer your blood products. If the doctor also prescribes uterotonics, you have to administer uterotonics. These are medications that are uterine stimulants. They help to stimulate uterine contraction. Okay, so for me, how I remember it is oh my hemorrhage. O is for oxytocin, which helps to stimulate uterine contraction. The M is for the methyl ergovin, which is a vasoconstrictor. The advantage of this vasoconstrictor is that it also increases the blood pressure in a situation where the patient has a low blood pressure. Then we administer the hemabate. The hemabate is a prostaglandin, which also helps to stimulate the contraction of the uterus. Now, one thing I always tell people is that when as you're doing all these things, you always need to assess. So you always need to assess and monitor patients' vitals frequently to ensure that your interventions are working and your expected outcome is being met. Thank you so much for listening. And if you have any other topics or any other topics you'd like me to discuss on, please drop it on the comment section. I just want to say thank you to the person who suggested this topic to me. And feel free to share, like, and follow our page. And also comment what you think about this topic. And if you have any other suggestions for us. Thank you so much and have a wonderful day. Bye.